It's estimated that a woman's risk of developing ovarian cancer is 1 in 73. Prognosis varies, but for patients with advanced ovarian cancer who've had 3 or more lines of chemotherapy, treatment options are progressively limited, but there's something new available. Dr. Ursula Matuloni joins us now to explain how this new treatment works. Good morning and welcome.
Good morning. Thank you for having me on the show.
What are the signs and symptoms of ovarian cancer?
So the signs and symptoms of ovarian cancer are sometimes very common symptoms that we can experience during our daily lives. And these can really be abdominal bloating, abdominal swelling, constipation, pain, abdominal pain or lower pelvic cramping, and sometimes difficulty with digestion. It's important for women to remember if they're developing these symptoms or they have them for more than 1 or 2 weeks, or they're happening and they're very concerned about them, that they seek medical attention to figure out why these symptoms are happening.
Are certain women more at risk than others?
So certain women are more at risk for developing ovarian cancer, yes. And we've identified women who harbor the BRCA gene, so the abnormal BRCA gene. And this gene can be inherited from either your mom or your dad. So it's not just from your mom's side, it can be through your dad's gene pool as well. And it's important for women to understand their family history. So if there's relatives that are being diagnosed with breast or ovarian cancer, really take note of that, because an individual can undergo a blood test to determine if they carry this gene or not. If they carry the gene, then they can undergo risk-reducing surgery, meaning they can take out ovaries, take out their fallopian tubes, obviously doing that after having their children.
How does the BRCA gene mutation impact ovarian cancer diagnosis and treatment? What's the connection there?
So the connection, in terms of diagnosis, is really to prevent somebody from being diagnosed with ovarian cancer. So really identifying that an individual harbors the gene, undergoing risk-reducing surgery. If a patient develops ovarian cancer, about 15 to 20% of all ovarian cancer is related to this BRCA gene. And it's important to know, well, at that time, because that individual's family can be tested. But also, if that woman undergoes surgery and chemotherapy, which is standard for ovarian cancer treatment, and if unfortunately she develops recurrent ovarian cancer, the FDA has just approved a new drug called a PARP inhibitor, which is a targeted therapy. The drug is called Lynparza, otherwise known as olaparib, that targets that abnormal BRCA mutation, and has been quite successful in treating women who have recurrent ovarian cancer, have an underlying BRCA mutation, and have been treated with 3 or more lines of prior chemotherapy.
This is an important development for those women, for their families. Is there a website, in case our viewers who are watching now, they're curious, they want to know more, where would you direct them online?
So specifically to read about Lynparza, the website is www.lynparza.com to really understand the indications for Lynparza and understand how the FDA came to approve it. It's a really important drug.
Dr. Matuloni, thank you for telling us about it today. We appreciate your time.
Thank you so much. Thank you for having me.